What's up? How's everybody tonight? My head hurts. It was a heck of a day. Learning new things it's the most rewarding when you can figure things out and get to that point. But sometimes the struggle is absolutely real. Something, that I absolutely enjoy, regardless. All right. We are ready to go live. All right. Good evening, everyone, and welcome to another enlightening episode of Know Your Pharmacist Stream Live this beautiful April 3rd, 2024. I'm your host, Dr. Joaquin Acosta, CEO of Pharmtrue, here to navigate you through the intricate maze of healthcare and wellness, infused with innovative AI insights. And tonight, we're venturing into an extraordinary exploration of how our world is transforming before our very eyes. From the aisles of Costco, where revolutionary health access is being rewritten, to the virtual corridors of Pitt Pharmacy, where augmented and virtual reality are reshaping education. Pretty cool. We're covering it all. As we delve deep into these topics, my aim is to connect with each of you, not just as viewers, but as active participants in this journey of discovery and learning. Let's collaborate to understand these changes, and let's infuse our dialogue with empathy and expertise. I'm here to guide you through these fascinating developments with a blend of warmth, personable insights, and competent science-backed knowledge. Imagine a world where healthcare is not just a service, but an experience enriched by the power of technology and human connection. That's the world we are stepping into tonight. As we discuss the challenges and breakthroughs, let's remember that each story, each innovation, is a step towards a healthier, more informed society. Remember, our journey doesn't just stop at acquiring knowledge, it's about applying it, living it, and every piece of information you'll hear tonight has the potential to change a life, maybe even yours. Let's engage, ask questions, and share our experiences together. We're not just viewers and a host, we're a community shaping the future of healthcare. And a huge shout out to our wonderful sponsors, Pharmtrue, High Horse Cannabis Company, Vado Speedway Park, and the Baked Chicken Farm, whose unwavering support makes this exploration possible. So grab your favorite seat and let's embark on this captivating journey. Be ready to be inspired, informed, and invigorated. Welcome to Know Your Pharmacist, where every conversation is a step towards a brighter, healthier tomorrow. Let's get started. All right, so jumping on in, Pharmacist Frontline segment brought to you by Pharmtrue. Costco coming out of the woodworks today to go put the market on an absolute show. Sharing that with you guys right here, right now. Pretty insane. So new news from CNN talking about how Costco begins offering Ozempic prescriptions to some members. Check this out. Some people go to Costco for $1.50 hot dogs, others for its $179 Ozempic prescriptions. How incredible is that? The warehouse retailer is now offering its United States members access to prescriptions for the GLP weight loss drugs through its low-cost healthcare partner, Sesame. Costco first partnered with Sesame, a direct-to-consumer healthcare marketplace that connects medical providers nationwide with consumers, last fall when it began offering its members online health checkups for as low as $29. About 2 months after that announcement, Costco and Sesame noticed that about 1 in 5 customer inquiries was about weight loss help and began working on a new program to address that interest, according to Sesame founder and president Michael Bota. It wasn't what we initially thought that would make sense to offer for Costco members who were coming to Sesame, but we realized pretty quickly, just by looking at what people were curious about, that there was a clear unmet need here. Due to their labor, a renewable 3-month program officially launched on Tuesday. It includes a video consultation with a weight loss doctor or specialist, GLP-1 or weight loss prescription if appropriate, and ongoing support through unlimited messaging and guidance with the healthcare provider. Sesame says it will be able to prescribe injectable semaglutides, including Ozempic and Wegovy, as well as oral weight loss medications, and the company advertises that patients could lose 5% of their body weight in just 3 months, 10% in 6 months, and 15% in a year. Cost of the medication is not included in the $179 3-month plan, and Sesame warned on its website that without insurance, GLP-1s can cost between $950 and $1,600 per month. Ozempic, Wegovy, and other GLP-1 prescription drugs have already swept through wealthier demographics of the country, but Bota hopes that offering the services to Costco's 130 million cardholders can help broaden its customer base. Increasingly, there is more interest among mass affluent, among the middle class, among almost everybody, he said. Obesity is prevalent across every socioeconomic status in America, and there are a lot of people who have interest, who have the need, and we saw that in the data. United States healthcare providers wrote more than 9 million prescriptions for Wegovy and other injectable drugs used for weight loss during the last 3 months of 2022 alone. JP Morgan researchers estimate that 30 million people may be taking GLP-1 drugs by 2030, about 9% of the U.S. population. I gotta say, it's better than opioids. Weight Watchers launched a new membership plan that gives members access to doctors who can prescribe these medications, and also made a $100 million plus deal to buy Sequence, telehealth business that can offer virtual prescriptions where appropriate to patients for these weight loss drugs. Luxury gyms such as Lifetime are also acquiring weight loss clinics with doctors who can prescribe GLP-1s, while Equinox is designing exercise programs specifically for people taking the medication. So, again, how I'm not exactly sure how the billing and the insurance coordination goes for this. Typically, for Ozempic, you have to have type 2 diabetes to be prescribed a GLP-1 agonist. It's not just for obesity. That's what Wegovy is for. Wegovy was really hard to keep in stock, but perhaps, through the Sesame program and everything, it could be that they're managing the prior authorizations, to make sure that the prescriber submits the correct appeal to the insurance to show that it's medically necessary for the insurance to thus pay for it, and then getting that price down to the $179 as the copay. I have no idea how they're arranging that, because it's not as easy as it is said and done, but I'm imagining that, it is going to be a solution for a lot of Costco customers, and it may attract new people to go to Costco to sign up to be a part of this program. I could only imagine that too. From other random medical services I know Costco offers, such as hearing aids at a pretty incredibly affordable rate versus, your standard market price. And I think that's cash, maybe with insurance. I don't entirely know the program, but this is interesting. We'll see where it goes. Eli Lilly came out with their Zep-bound medication, which is actually FDA approved for weight loss, and they created Lilly Direct, which is for basically getting the online, weight loss drugs through the Eli Lilly company directly. Showing you guys this one, I do think even if you don't have insurance, they can get the drug at like $500 because they do produce it. Again, a drug that costs pennies on the dollar to make, and you slap a nice big sexy brand name on it and call it Ozempic and Zep-bound and all these things, and TikTok has at it, and all of a sudden here we are. But either way, I like the positive health outcomes of taking down obesity, fighting weight loss, taking down A1C, hopefully getting to the people to the point to kickstart their metabolisms, get the weight down, hopefully pick up healthy habits and not just become reliant on the GLP-1s. Don't want to see too much pancreatitis coming up, but we never know what could happen out of that. But there are some cardioprotective benefits of like Ozempic, right, for instance. And so, cheers to Costco. I'm very excited to see what happens there. But again, the big counterpartner was like considering like where the manufacturers are hiring their own telehealth doctors and just saying, hey, you can get this online. It can be a lot of options for people to get their GLP-1s. And the bougie gyms that buy their own med spas and weight loss clinics and include the gym in there, that's an absolutely insane business model too. Can't knock them, right? You got to try it. So pretty cool. Pretty cool, especially when you consider like a lot of the prior, gym histories in the past. There's just a lot of underground market for all the drugs that are making people look so good. Just to go to the gym to look good and then probably sling those drugs around the gym. So anyways, those are just little opinions there, one way or another. Move on to tech talk. So some interesting stuff talking about transforming learning at Pitt Pharmacy with augmented and virtual reality. They're pretty insane. Take a look at these students learning here, engaging with the heart. This is a cool way to learn, not going to lie. From Oculus's gaming systems to Apple Vision Pro, Pitt students are no strangers to virtual reality, VR, and augmented reality, AR technologies. However, for the first time in fall 2023, 115 school pharmacy students used this technology to step into their studies during the pharmacotherapy of cardiovascular disease course. We're teaching students how to use medications to treat different types of heart disease, but before they can do that effectively, they need a good foundational review of heart anatomy, says Jim Coons, course instructor and professor in the Department of Pharmacy and Therapeutics School of Pharmacy. The course is part of the Doctor of Pharmacy program's 6-year entry-level professional program over at Pitt. While the course has used Pitt's Peter M. Winter Institute for Simulation, Education, and Research human patient simulators since the mid-2000s to offer students an interactive learning experience, anatomy lessons remain primary lecture-based. Still pretty cool though, right? I mean, this is going to be a new way of learning. Absolutely. Pharmacy students here explore their cardiac anatomy lessons in 3D using HoloLens 2 AR headsets in the Allen McGee Safety Hall over at Pitt. And, reading a little more, with a little help from Pitt Health Sciences Information Technology, last year students turned away from PowerPoint slides and immersed themselves in anatomy lessons using an anatomage table. Crazy. Don't even know these words because they're pretty new. Akin to dining-size table iPad, the HoloLens 2 AR headsets. A million miles away from what Jim used to do, said Larry Kablinski, an instructional designer who has helped support the course since 2013. Show something three-dimensionally manipulated by turning it and removing sections, something you could have never imagined years ago, right? And, for me, looking at a 2D diagram of the heart, granted, we've all came up studying like that and we totally understand, but hey, this is actually pretty dang cool, right? Like, got to give them the credit there to be able to go and look at all the different valves and every quadrant of the heart and, really get that space and time reference of, what's going on in there. And I think that's awesome. So anyways, looking at the combination of the anatomage molecules and AR technologies for various disease states and diagnostics dramatically enrich student learning. Standing in front of 3D heart, they can now explore beyond the heart's chambers, right? Students can interact with the heart's arteries and conduction system, examine healthy and unhealthy cardiac anatomy, and monitor medications where they work in the heart. Using the HoloLens technology here, students interact hands-on and virtually with the 3D heart anatomy. Just imagine, really just having that headset on and then actually having like a professor that knows what they're talking about, so you can sit there and ask questions while you've got the little heart to play with in front of you. That's pretty cool. Not everybody has a lab where they can go dissect dead bodies, for instance. And not every pharmacy school program allows, pharmacy school students, for instance, to go and do that sort of thing. In med school, it's pretty standard. Nursing school, you get some time in there. Maybe physical therapy school, but again, this really opens it up. So I think that's a great way to learn, right? People learn by seeing, feeling, touching, hearing, watching videos, reading on paper. This really, really combines a whole lot of things that we don't quite get to, really experience in life, right? So I think this is cool. Again, I'm sure most people do, but looking here, once you're in the environment, you can pick up on the electronic medical record tablet and scroll through pages, talk on the phone, view patient information, insert IVs, and make order entries off the EMR tablet. In the VR case, students will interact with a critically ill patient, nurses, and physicians within an infectious disease settings. And as students interact with their virtual patient, they may see changes in the labs within the EMR, as well as real-time changes like a drop in blood pressure or other signs that the patient has become unstable. Your patient may even develop new complaints to consider. So now you really look at the way you can create scenarios and some role-playing situation and some real-life scenarios. I mean, this is cool because, yes, it gives the student and challenges the student in different ways than before. If you're just shadowing, in some sort of code in the hospital, unless you've got an awesome preceptor, you're just going to be sitting in the back, perhaps ideally trying to soak it all up like a sponge, but we all know the reality that that's not going to work for everybody. You get put on the spot to go make some critical decisions, and all of a sudden we're beefing up our healthcare providers. Getting better trained, getting better educated, that's exciting. So sharing in our Tech Talk, how about that from the Pitt Pharmacy? Hopefully, seeing this kind of stuff all over healthcare, where we already know we suffer from a need, of healthcare providers, healthcare access is insane. really increasing the amount of clinical knowledge and just general pharmacy knowledge through means of AR and VR is awesome. Yeah, can't even complain at all. All right, let's move on to Enlightenment Hour, guys. Coming out of NPR today, mental health care is hard to find, especially for people with Medicare and Medicaid. Give me your thoughts on this. I don't know how this affects people in New Mexico one way or another. But I bet there's definitely some take-home points, right? And so I'll kind of give you mine. But here, let's start with this.
The United States is in the midst of an unprecedented mental health crisis. Suicide rates and opioid deaths have risen over the past decade. Rates of anxiety and depression in children have soared. And accessing care for mental health issues continues to be a challenge, particularly for the country's most vulnerable populations. A new government report finds there is a dire shortage of mental health providers who accept Medicare and Medicaid. Here to tell us more is NPR Health correspondent Ritu Chatterjee. Hey there.
Hi, Mary Louise.
All right, tell us who wrote this report, what part of the government's it coming from, and a little more about its findings.
Yeah, so this report is from the Inspector General for the Federal Health Department, and it looked closely at 20 counties across the country to see how people who get their health insurance from the government are able to access mental health care. And I'm talking about people on traditional Medicare and Medicare Advantage, so mostly seniors and people with disabilities, and then Medicaid, which is for those on low incomes. And the report found that on average, all three programs had fewer than 5 mental health care providers for every 1,000 enrollees in most counties. And some didn't even have a single provider for the same number of people.
Fewer than 5 for every 1,000 people. That's shockingly low.
Yeah, and I should point out that the need for mental health care is really high in this population. Here's Meredith Seif, the Regional Inspector General and the lead author of the report.
You have 1 in 4 Medicare enrollees who are living with a mental illness, yet less than half of those people are receiving treatment. And in Medicaid, the need's really even greater. You have 1 in 3 adult enrollees living with a mental illness, and you have 1 in 5 living with a substance use disorder.
And given that Medicaid and Medicare together serve nearly 130 million people, we're talking about millions of people not getting the care they need. And the report also found that a significant number of people also have to travel for a long time to see a counselor or a psychiatrist, which, as you can understand, can make it really unsustainable in the long run.
Okay, so let's talk about what's behind this. Why are there so few providers participating in these programs?
So, part of it is a nationwide shortage of mental health clinicians, but for Medicaid and Medicare, that's not the whole story. The report found that only a third of all providers in these counties are participating in these programs. And one big reason is that the programs don't pay mental health care professionals very well. Here's Deborah Steinberg. She's a senior health policy attorney at the nonprofit Legal Action Center.
In the Medicare program, they set a physician fee rate. And then for certain providers, which includes clinical social workers, it includes the newly covered mental health counselors and marriage and family therapists, they get reimbursed at 75% of that rate.
And Medicaid pays even less. And then on top of that, there are huge amounts of paperwork that both programs require. So that discourages participation too.
So briefly, Ritu, who's trying to fix this?
So the Center for Medicare and Medicaid Services, CMS, has taken some steps. So, for example, it's increased payments, but experts say, a lot more needs to be done to address these shortages.
NPR's Ritu Chatterjee, thank you.
Thank you, Mary Louise.
So, taking this
And now, more from NPR.
Taking this down to kind of New Mexico and thinking just, I feel like we have a lot of mental health providers and services here in the state of New Mexico. Perhaps, when you actually go through the system, it's not as easy as you may think. I definitely can perhaps attest to just, from my experience alone, that mental health care providers and mental health facilities absolutely exist because, there's good money in that for sure. But, when it comes to primary care, managing mental health services for such as Medicare patients, are we really getting, outside of the scope? I'm not really sure. if it becomes PCPs doing a lot of that management for those kinds of medications and for those kinds of, basically health conditions when it comes to mental health, who's managing it, right? Primary care providers, probably, especially for, our Medicare patients and our Medicaid patients. There's some other interesting stuff here I wanted to share from another survey about. This one's actually coming from the University of New Mexico, and this was a New Mexico Department of Health Services health survey, and some interesting stuff. Anyways, coming out of here, roughly half New Mexicans are unaware of changes in Medicaid coverage eligibility process. So keeping people, enrolled can perhaps be a struggle. That's an interesting concept, and we already probably kind of understand that absolutely. With about 40% of Medicaid enrollees on average here, between 35 and 40, not even really checking to see whether they know if their benefits are renewing, so on and so forth. But, New Mexicans in general, according to this, are very supportive of using Medicaid funding to address social determinants of health that drive negative health outcomes. And look at some of this stuff here. Mental health services could probably fall within a lot of these kind of support questions, aka expanding access to early childhood development and prenatal support, addressing domestic violence, addressing homelessness, expanding employment and training, education, expanding access to abortions. Other things here, it's down here. So the access and use of healthcare among families in New Mexico. This survey included several questions on access and to utilization for healthcare for children that were asked to parents who have children under the age of 18 who live in their homes. As reflected in the figure below, we'll get to it, when children are sick and in need of medical care, most parents in New Mexico, 72%, have access to a doctor's office or health center where they get regular care. This is highest in Doña Ana County. Hey, pat on the back, where 81% of parents have access to a doctor's office or health center. Native American respondents were far less likely to have this access, 63%, less than 9% relative to total. And similarly, children of foreign-born respondents, less than 10%, and residents of Bernalillo County, 65%, were also comparatively less likely to have access to doctor or healthcare center. Now, I don't understand the Bernalillo County one because we've got, UNM right there, right? UNM health centers, they're awesome, right? They're everywhere, and, especially in Bernalillo. But, still interesting. And maybe, for instance, Albuquerque can be so big that it just can feel just lost in the sauce. I have no idea how that works. But other things here, nearly 29% utilize urgent care, 21% have utilized the emergency room, and 70% use pharmacies, including those in grocery stores. Utilization of the emergency room is highest in Santa Fe County, where nearly a third of patients rely on the emergency room for their child's health care. Interesting. Small percentage, 4%, indicated that they do not have a place to access where they usually receive care. And here's that chart. When your child is sick or needs medical advice, where do you usually get their care? The big one, doctor's office, Doña Ana County, right? Anyways, the majority of New Mexican parents, 77%, have a primary care provider for their child. This is an important measure given the positive correlation between access to a PCP and a host of child well-being outcomes. There are several inequalities in access to primary healthcare provider among New Mexico families, however, and this includes the similarities discussed before, such as Native Americans -6%, Bernalillo County residents -5%, were less likely to have a primary care physician for their child. Biggest obstacle to a PCP among parents is being able to schedule an appointment, as 16% of parents without primary care physician for a child indicated this was the primary reason. Another 11% said that they could not find a doctor who takes their insurance, including 13% of Medicaid enrollees. 15% of parents said that the doctor's office is too far away and not convenient. Interesting. Physical distance is particularly challenging for rural residents, 17%, which makes sense, who says that this was the primary reason that they lack access to a PCP. So we look at things, in my, opinion here, it's very interesting to see, we're saying about 10% of parents here are using virtual telehealth appointments, right? Under a third, aka 29% of parents, needed mental or behavioral health for their child, including counseling, with 88% of parents indicating they were able to get the care that they needed for their child. Parents who received mental health care did so across a range of locations, With many parents indicated they utilize mental health services across multiple locations, school being the primary, 34%, their primary doctors or provider's office, 45%, mental health specialist office, 55%, virtual, telehealth, 10%. And, it's just interesting to look at that against the trends of where telehealth really is going, because, telehealth trends when it comes to mental health services, are definitely starting to pick up. I'm not sure if, the payment is very good on the back end, but in terms of looking at how, the efficacy of using virtual healthcare, mental health is one of those places where it really could be used very well, because you don't perhaps need the physical assessment in such the same manner, right? And so it gives you some of that ability to do it virtually. So, I didn't talk about Medicare patients though, right? Right now, New Mexico, 21% of the state's population are Medicare beneficiaries. It's almost 500,000 people. Most New Mexico residents become eligible for Medicare when they turn 65, but about 14% are on Medicare due to disability. That 14% due to disability is probably where you're going to see a lot more mental health efforts concentrated, whether it's, right, I'm fumbling for words, but there's a lot of different, assisted living, skilled nursing facilities, even halfway homes, things like that, where kids do get access to that kind of care and service, right? The ACT programs, things like that. And so those are some very high dollar, reimbursements for people. About 31% of people in New Mexico and adults with mental illness reported having Medicaid coverage in 2022, which was interesting too. So, I don't know, in terms of contrasting the NPR special there about, the access in New Mexico may not be as rough as it is in other states, and maybe in dense metro areas there's a need. Who knows? But again, all food for thought here in our Enlightenment Hour. And again, where I would want to recommend and push people to is, if you really can't get a healthcare provider, especially when it comes to mental health, try telehealth, right? And maybe people don't necessarily consider that they've got like a good enough phone coverage or internet, streaming capability or whatever that may be. But be surprised, right, that you could really just pick up the phone and you could have virtual appointments just by phone. And maybe it doesn't, hit every single mark that you want, but it can get you closer to than where you were. So let's look in our Herbal Wellness Corner, brought to you by High Horse Cannabis Company, guys. This one's an interesting one that could set some precedents, going forward in the future for the cannabis industry. Firing back at the New Mexico Cannabis Control Division, a manufacturer filing a lawsuit against a recall. So check this out from KOD.
So today actually marks 4 years of legal recreational marijuana sales in New Mexico. But instead of a celebration, the Cannabis Control Division is now facing a new lawsuit.
Yeah, a local cannabis manufacturer is suing the state agency over a recent recall of some of its products. Spencer Schott spoke with the manufacturer's attorney tonight. Spencer?
Yeah, he's calling the recent recall unlawful and says the state didn't follow its own rules when issuing this recall a little more than 2 weeks ago.
It's the newest controversy in New Mexico's fairly young legal recreational marijuana industry. Less than 2 weeks ago, the state's Cannabis Control Division posted a recall notice, ordering the manufacturer, Farmers LLC, to destroy some of their product. The notice indicated some cannabis concentrates tested positive for prohibited pesticides.
The products that are being recalled were manufactured by my clients in the fall of 2022. At that time, these products passed every single applicable pesticide and other test mandated by the state of New Mexico. Fast forward almost a year later, a third-party cannabis retailer submitted one of the products to a testing laboratory for a voluntary, quote-unquote, shelf life test. That test identified the presence of a pesticide called malathion.
Jacob Candelario represents Farmers LLC in the new lawsuit against the Cannabis Control Division. And it's true, malathion is not listed as one of the state's prohibited pesticides.
At no time since 2022, and even sitting here today, has the Cannabis Control Division issued a rule or regulation that's been subject to notice and comment about adding malathion to the list of pesticides that must be tested for. So that's issue number one.
But malathion isn't on the list of approved pesticides either. The state's rules around cannabis testing allow labs to test for other pesticides and then report those findings to the Cannabis Control Division. But Candelario argues the state isn't allowed to issue recalls based on those voluntary tests.
My clients were not afforded the sort of due process protections or anti-contamination procedures in these voluntary tests that were conducted in March of 2024.
The lawsuit is now asking a judge to stop the recall and for the CCD to publish a retraction. I also reached out to the CCD, and a rep said they couldn't comment on ongoing litigations. However, they did send a statement saying, in part, one of the division's top priorities is protecting public health and safety. And the March 22, 2024 notice was issued to notify the public about cannabis products that contained potentially harmful contaminants. I asked Candelaria if he believes the issues surrounding the recall are due to the CCD being a relatively new entity in our state, and he said that's no excuse. It's a state agency and they should follow their own rules. Tessa, Trevor.
Some gray areas there, obviously. All right, Spencer.
So here we begin, right? The war with the CCD and manufacturers and public health. And I think it was all fine and dandy, right, until something huge like a big first recall comes out. And, Farmers Quality, they are one of the top manufacturers, if not the best manufacturer, in the state of New Mexico, and have been really pushing quality concentrates out on top of their edibles and everything else that they do for a long period of time. So it is interesting to see how obviously bad press can be really bad, that, people were up in arms, and the funny thing is, interestingly enough, just kind of as a third party bystander, a lot of the people that were up in arms about this were people that, are potential competitors, right, that are kind of just haters that were kind of fueling a lot of that conversation. And so where you look at one third party test for a pesticide that perhaps was not, even ever on the noted list of an illegal product to use as a pesticide, that does seem perhaps a little unfair to go and run farmers, brand and name through the mud, because those kinds of things can really affect, things going forward, on top of the farms that they had sourced that, that cannabis flower from, that, people started getting questionable, thoughts on. So you look at it both ways. I think this is just going to be a good legal case to hopefully set a little more precedence in how things happen in the future. Of course, we know the New Mexico Cannabis Control Division has the public health interest in mind. They've also made, Mexico as a whole has also already made over $1 billion in cannabis sales, right? That's got to be like close to 200 million in taxes, right? Somewhere between 100 and 200 million. When you look, medical sales are probably a very minute part of that. We don't get taxed. Other than that, you're paying a big cannabis excise tax and then regular state taxes on top of that. So again, right, the best producers, the best manufacturers are the ones that are going to be contributing to the most amount of tax coming back into the state. So I think they should look at each other as partners there versus enemies of the state or whatever it may be. And I don't think farmers by any means is trying to position themselves in that way. And I do support both sides of the coin here. And, I don't think you necessarily have to pick a side. I can see where you want to protect yourself as a producer, as a manufacturer, if you're following and doing all the rules. And then, of course, a big headline that says pesticide found in farmers, edibles or farmers concentrate, all of a sudden recall, boom, boom, boom. Those headlines are triggering, right? And there's over 1,000 dispensaries in the state of New Mexico. There's a lot of manufacturers. There's a lot of competition. And so people find ways to burn each other and to do these things. And that's kind of the ugly side of the industry. And, I think the truth would be the most important thing to pull out of this that hopefully does protect, our public going forward, whether it's adding that pesticide to the list of pesticides that aren't approved going forward, and still perhaps either, you could retract the recall or do something about the situation to perhaps not let farmers get so banged up by the media because of the way that came out. So who knows? But my eyes are definitely going to be on that story for sure. And, we hope at the end of the day that everybody is just safe and healthy and happy and able to make money, right? And you don't want to see the wrong intentions driving behind some of these accusations or some of the flare up, in the media or whatever that may be. So we'll see how it all plays out. And that's our Herbal Wellness Corner, brought to you by High Horse Cannabis Company, guys. Jumping on into our community spotlight, brought to you by the Big Chicken Farm. Saturday, April 6th, this Saturday in the Downtown Plaza, Electronic Caregiver. Awesome stuff. They're having their annual Community Health and Wellness Fair. Still looking for vendors. Looks like, I don't know, perhaps up to 40 booths still remaining, $40 vendor fees. Community Health and Wellness Fair. This is happening right during the farmers market. Sweet time to, go cruise the farmers market on top of enjoy an awesome health fair in the middle of Downtown Plaza. Get a bunch of health screenings. Go check out, Electronic Caregiver and all this cool technology stuff they have to offer. I can only imagine how much cooler and how much faster their stuff, continues to develop at a rapid pace, especially with, the advancements of technology in the last, 3 to 5 years for sure. Absolutely changed, and they were already ahead of the curve before all that kind of AI and generative AI stuff became, very public, right? So one of the bigger technology players here in our state, and just so happened to be, pretty much filling up that old Wells Fargo tower floor by floor, with their giant amounts of programmers and employees and all that stuff. So cool stuff. Go check out that health fair, cruising the farmers market up and down. Beautiful place in downtown Las Cruces. I think all of you Las Cruces people know what I'm referring to in that aspect. And, go get some health screenings. Guarantee you there's going to be a lot of great healthcare providers participating with these guys. And you may save perhaps a lot of money in copays and or just get the right lead that you need to do to ask the right questions and do those things. So last thing in our Men's Health Minute tonight, guys, talking about magnesium. Brought to you by Vado Speedway Park. Vado Speedway Park aired a special today on I think KTSM News Channel 9. Over like this, it was like the small town special, and they did like an awesome 3-4 hour show over at Vado, running the sprint cars. They had, I think, like Charlie Clark's Nissan out there, and they were showing off some of those cool cars. Orale, I really like those commercials, not gonna lie, but getting our Diamond in the Desert some absolute airtime there, and getting to really show off the things that they bring to the town of Vado, and putting Vado on the map. That's been the mission behind the racing passion of track owner and race car driver himself, Royal Jones there. So awesome stuff. Local guy, big time winner. Anyways, groups at risk for magnesium inadequacy. Guys, I think, men can easily fall into a lot of these categories. People with GI diseases, people with type 2 diabetes, people with alcohol dependence, and older adults. Low intakes of magnesium induces changes also in biochemical pathways that increase the risk of illness over time. Focusing on diseases such as hypertension and cardiovascular disease, type 2 diabetes, osteoporosis, and migraine headaches. Right? So things like, again, alcohol, GI disease, type 2 diabetes can decrease those magnesium levels. Are we getting enough magnesium in our diet? Men above that age, 14 to 18, you're definitely looking for about 400 milligrams of magnesium per day that you want to be trying to either supplement with or get through things like a food source. What are cool food sources of magnesium? Almonds, pumpkin seeds, spinach, cashews, yogurt plain, brown rice, potato baked with skin, a banana, milk, halibut, raisins, bread, avocado, chicken breast, beef. Getting me hungry just reading all those off the list. But hey, don't forget that magnesium is a big player in a lot of the things we do. Easily can get depleted, especially just after something like maybe a heavy night of drinking, right? Or a heavy bout of exertion. We look at, for instance, sodium and potassium, things like Pedialyte. Well, again, perhaps magnesium sometimes is one of those players that doesn't always get counted in, right? So if you're going to have a heavy weekend on deck, keep that magnesium nearby for sure. Also, again, try to get those 400 milligrams in a day. Magox 400 is a perfect over-the-counter supplement to go ahead and dial that in. And ideally keep your levels sufficient. You look at things like not only your muscle cramping and your muscle contractility and function there, and hypertension, and it's not the funnest stuff that we want there. So let's keep our levels optimal. If you want the perfect supplementation recommendations, I dare you to go get your labs checked, see exactly where your levels are over time, and then supplement accordingly. Get your labs rechecked and make sure everything is on par. Boom, boom, because then you're going to be hitting vitamin D. You'll probably get your PSA, your prostate exam, thyroid levels, all those kinds of things. Make sure everything is in tune, on top of, for instance, hormone levels and things like that too. Definitely good to try to keep them in balance, in check, and stay healthy. All right, guys, that's Dr. Joaquin finishing up tonight.